Okay, let's talk about something that, well, a lot of us have heard of and way too many of us have had to deal with. A urinary tract infection, a UTI. But what is actually going on inside our bodies when this unwelcome guest decides to show up? Let's take a journey inside this super common, but honestly often misunderstood infection.
And just to get a sense of the scale we're talking about here, look at this number. We're talking over 150 million cases of UTIs happening across the globe every single year. That's just a massive number. It makes this way more than just a personal annoyance. It's a huge public health issue.
So that leads us right to the big question, doesn't it? What is it about UTIs that makes them the second most common infection in people, right behind respiratory infections like the common cold? It's a really interesting story of our own anatomy, a bit of bad luck, and a very, very persistent intruder.
So at its heart, a UTI isn't just about bacteria being in a place they shouldn't be. It's really about your body's reaction to them. It's an inflammatory response. You can think of the lining of your urinary tract like an alarm system. When it detects an invader, it sounds the alarm, and the fight is on. That fight is what causes all those fun symptoms.
Okay, so how do these invaders get past our defenses to begin with? Where does the invasion even start? Let's trace the path they take.
First up, here's the territory we're talking about. You've got the kidneys, which make the urine. That urine travels down these tubes called ureters into the bladder, which is basically a storage tank. And then finally, it leaves the body through the urethra. This whole system, this is the house that the bacteria are trying to break into.
Now, you might think the infection starts deep inside, but that's not usually how it works. The most common path is what's called the ascending route, meaning it starts from the outside and works its way in. First, bacteria from the surrounding skin just kind of gather around the opening of the urethra, and then they start their journey upwards, ascending into the bladder. And that's where the trouble really begins.
So here's a huge question. Why are women so much more likely to get UTIs? We're talking an 8-to-1 ratio compared to men. Well, a huge part of the answer is just simple anatomy. The female urethra is just much, much shorter. That gives bacteria a shorter, easier trip to the bladder. In this case, distance really does matter.
And who's the main villain in this whole story? Well, meet Escherichia coli. You probably know it as E. coli. This one type of bacteria is the cause of a whopping 80 to 90% of straightforward UTIs. And it's so good at its job because it has these tiny little leg-like things that let it cling to the bladder wall, making it really hard for your body to just flush it out.
So, once the bacteria have breached the defenses and started to multiply, your body doesn't just sit there and take it. It fires up that alarm system we talked about. So let's get into the signs and signals that tell you an invasion is underway.
Now, this is a really critical point. Not all UTIs are the same. It all comes down to location. If the infection is just in the bladder, we call it a lower UTI, or cystitis. That's the most common kind. But if those bacteria keep moving up the ladder and reach the kidneys, that escalates things to an upper UTI, or pyelonephritis, and that is a much, much more serious situation. So, for a lower UTI, these are the classic miserable signs. That unmistakable burning feeling like you have to go to the bathroom all the time. Pain in your lower belly, and maybe even noticing your urine looks cloudy. This is your body's localized, hey, we've got a problem down here, alarm. But if that infection travels up to the kidneys, the alarms get a whole lot louder. Now we're talking about body-wide symptoms, a high fever, chills, serious pain in your back or side, even nausea and vomiting. This is a huge red flag that the infection is getting serious and you need to get medical help right away to avoid really dangerous complications.
Okay, so you've got the symptoms. You know something's wrong. How do doctors actually prove it's a UTI and pinpoint exactly which bacteria is causing all the trouble? For that, we have to head into the lab. The first step is usually a quick and easy dipstick test. Think of this as the initial detective work. It's a fast screening that can find the chemical clues an infection leaves behind. Specifically, it's looking for white blood cells and bits of bacteria. It's the first piece of evidence. And if you were to look at the lab results, the difference is pretty stark. Normal urine is clear. It doesn't have bacteria or white blood cells. But an infected sample, it's often cloudy and it'll light up positive for all these key signs that your immune system is in a full-on fight. But to get the definitive smoking gun, doctors need to perform a urine culture. Basically, they take a sample and put it in a petri dish to see what grows. This lets them get a positive ID on the bacteria.
And, just as importantly, it helps them figure out exactly which antibiotics will be best at knocking it out.
So what's the magic number that screens infection? Well, traditionally, it's this: 10 to the 5th power colony-forming units per milliliter. A colony-forming unit, or CFU, is just one single living bacterium. So when the lab finds more than 100,000 of them in one tiny milliliter of urine, yeah, that's pretty much the gold standard for confirming a significant infection.
And finally, there's one more really important layer to all of this. You have to know that the context of who gets the infection matters a lot. That brings us to the difference between a simple or uncomplicated case and a complicated one.
An uncomplicated UTI is the kind we've mostly been talking about. It happens in someone who's otherwise healthy with a totally normal urinary tract. But a complicated UTI, that's when there's an underlying issue. Maybe the person has a catheter, or a problem with the shape of their urinary tract, or a weakened immune system. These factors completely change the game and make the infection much tougher to deal with.
And here are some of those key risk factors. A urinary catheter, for instance, is basically a direct highway for bacteria right into the bladder. Pregnancy can change your anatomy and make it harder to empty your bladder all the way. And conditions like diabetes can weaken your body's overall ability to fight back. Any of these things can turn a standard UTI into a much more serious problem that needs a different, more aggressive treatment plan.
Which leaves us with this one last thought. Our bodies have this amazing complex defense system. And we have antibiotics to help, but the bacteria are always changing, always evolving to get around our defenses. So the big question for the future is, how do we stay one step ahead in this microscopic battle that impacts millions upon millions of us every year?